hospital because of CHD. I've been here for 2.5 months.
Do you want to say maybe what happened when you first got to the hospital? What did they give you then?
I've had a VAD and then heart transplant.
Can you tell me maybe some things that have made it easier for you to be here?
Getting to know my staff.
Yeah, I'm Lindsey. So who am I on your team?
Psychology.
Mm-hmm. And who's Miss Jessie?
Child life.
Yeah, so you got to know us, which made it a little bit easier to do some of the things you didn't like to do, right?
Right.
What were some of the things that were hardest for you while you were here?
I didn't like to talk to people.
And how did that make being in the hospital hard when you didn't want to talk to people?
Because I didn't know what I needed. Now they know what I need and what I want.
Because you're talking a lot more now, aren't you?
Yeah.
What else has made your hospital stay better?
Shopping online.
Why don't you tell the camera what you like to shop for online?
Food. Chinese.
Who delivers to the hospital?
Grubhub. Cotton candy and cookie dough.
How many Frappuccinos do you think you've drank while you've been in the hospital?
4.
100.
Going to the food trucks.
Going to the food trucks. So Zaniyah's ordered food from the food trucks a few times. You like the barbecue place. Where else is good?
Crave Go Go.
Crave Go Go. Yeah. What else? What are your other coping skills?
This one goes with the first one.
Okay.
Learning to communicate.
Yeah. Learning to be clear in our communication.
It makes the stay easier.
I think your communication with Mom has gotten better.
Yeah.
What other advice do you have for kids in the hospital?
Get up on time. Go to bed early. You don't miss your food. You're not tired during the day. The sooner you get it done, the sooner you can go to sleep. It makes walking easier. Not sleeping in your own bed.
Any advice to the doctors and nurses?
Some kids will bite you.
Some kids will bite you?
No, for real. Just do your normal routine and ask them what they need. Get them out of their room if they can go. It's gonna be a little different. You can't go to petting zoos and stuff. You can't be rough.
Yeah, and before you got here, you did what?
Fought a lot with my sister.
Yeah, Zaniyah, man. Zaniyah and Zaniyah, they used to get in a lot of fights. So no more rough housing. Anything else going to be different?
Can't swim.
What about, did you take any medicines before you came to the hospital?
No.
Do you have to take any medicines when you go home?
Yeah.
How many medicines?
A lot.
A lot. So how are you going to remember to take all of those?
Set an alarm clock.
Set an alarm clock. So what do you want to do? Think to like 5, 10, maybe even 15 years in the future. What are you going to do?
The normal stuff that I used to do.
So your heart transplant's not going to get in the way? No. Do you think you're going to be a strong kid again?
Yeah.
Absolutely you are. So where do you go when you leave here?
Fraser.
And what are you going to do there?
Physical therapy.
How many hours a day? On Friday, we talked about it's a long, long day, right? So I'm going to get a little off topic, but I'm going to ask you, I've spent a lot of time with you, haven't I?
Yep.
A lot of time with you. We've covered a lot of things, right? We've talked about a whole bunch of things. Can you tell me maybe what were some of the best things that we did together that helped the most?
Bad thought guy.
Bad thought guy. So what helped? Why was bad thought guy so helpful? Maybe you should tell the camera who bad thought guy is.
This ugly broccoli looking thing Dr. Carter drew.
And what does he stand for?
The bad thoughts inside your brain.
What type of bad thoughts do kids have in the hospital?
Like, I don't want to do this. It's gonna hurt. They're doing this just to be mean to me.
And what's the real answer to that? The true
Not
answer?
really.
Not really. They're just trying to what?
Help me.
So who was Bad Thought Guy's worst enemy? What was her name? Do you remember?
Good thought girl.
And who was her sidekick?
A toothbrush.
And who else? She had one other sidekick. We made it together.
Communication cat.
Yeah, communication cat. If I can say something that I think has made your hospital stay a little bit better, is that Zaniyah, when we started working, we worked together from the very beginning, right? But when you started laughing and telling jokes and showing more of your personality to us, so when we got to know Zaniyah a little bit more, I think that made the hospital stay a little bit easier too. Don't you think?
Yeah.
Because we knew you more and how to help you more. Anything else that I should keep doing with kids? What?
Good things that you done with me.
Okay.
I think you guys have been a good team, by the way. Thank you. You know,
You think
Zaniyah and Lindsey team is kind of pretty awesome, I think.
Number 1. High five. First thing when you go home, what are you going to go do?
Make my mom make me lasagna.
Make your mom make you lasagna, and aren't you getting your nails done?